Patellofemoral pain is one of the most common causes of knee pain. In this video, I'll discuss what it is, what the common signs and symptoms are, and what treatments are available to help active people recover from it. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Patellofemoral pain is really common in young adults, teenagers, people in their 20s, early 30s, and it's very commonly active people and active patients. I had this when I was in my teenage years and early college and medical school years, and it's really uncomfortable. It's sort of a general term. There's other things you may hear: anterior knee pain, you may hear chondromalacia, but the commonly accepted term, at least in orthopedic surgery, is patellofemoral pain syndrome. And what that means is it's essentially an overload of pressure. If you look at the knee from the side, between the kneecap and the front of the thigh bone, usually not related to any damage within the knee, no cartilage damage or arthritis or ligament tears or anything like that, but an overload of pressure that causes a dull, achy pain all along the front of the knee. Usually does not come on with a specific traumatic event, but more often it comes on with overuse, using it for a long time over time. Runners, people in running sports, jumping sports tend to be most effective. Occasionally it can happen in sedentary people, but you typically see it more in overuse in people that are very active. Now, again, there's usually no structural damage, but it's this dull, achy pain that is just aggravating. Typically it hurts when you sit with your knee bent for a long period of time, and it feels better straightening your knee all the way out. Typically hurts going up and down stairs, especially going downstairs. That's a common thing. Typically you don't have symptoms like giving way or locking or catching. You don't typically have swelling of the knee, and you don't typically have very localized pain where you can point to one point and that's exactly where it hurts. This is more of a diffuse pain all around the front of the knee. Fortunately, it is one of these conditions that almost always gets better without surgery. Typically, that involves physical therapy and home exercise programs that you do on your own. There are a number of exercise programs you can find online that can be helpful, but I really like to send somebody to work with a physical therapist, especially a sports physical therapist, so they can help, by evaluating your knee, find exactly the underlying issues specific to you, and then design an exercise program targeting that specifically. And that can be very helpful. There are some knee brace, knee sleeve type of things that some people find helpful. I know some people find kinesio taping helpful. Those would be, in my mind, sort of second line treatments, maybe to help you deal with it while you're trying to play, maybe help with the pain as you're in a game, as you're in a practice. But the physical therapy is by far the quickest and most reliable way to get it better. Good news, again, very rarely needs surgical treatment, but again, very common. A lot of people have this, they don't even know what it is. They're just used to their knee hurting for a long period of time. All right, I'd love to hear your experience with your knee injury. Leave those in the comments below. Just understand I can't respond with specific medical advice, so I do try to address the topics in these questions in future videos. Make sure to subscribe to my channel, click the bell to be notified when I release a new video or start a new live stream like my Ask Dr. Geier live shows. If you have knee, hip, shoulder, or some other joint pain and you want to get significantly better in the next 30 days, without cortisone shots or surgery, you can learn more about working with me in the description below. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.